A lot of people want to know this. Will COVID-19 still be here come the fall? Likely. Should students be kept away from school because of it? Not necessarily. And that coming from experts at Sick Kids Hospital who have just released recommendations for what reopening schools could look like here in Ontario. Joining me with more is President and CEO of the Hospital for Sick Children, Dr. Ronald Cohen. Good morning to you, Doctor.
Good morning. Thank you for having me.
Thanks for joining us. I want to begin here. Right away, one of the top lines is that you believe, or those experts joined together through Sick Kids say, September, we should see a start. We should send our kids back, regardless of if this virus still exists. Why?
So I think what we know today, even more so than a few weeks ago, is that this virus is not going anywhere, not for months and maybe not a year or even two. And if we begin to internalize this, accept it, that we won't be able to eliminate the risk from the virus, but we'll be able to put certain mitigating risk factors in place to reduce the transmission and infectivity from the virus. And then put this all into the context that our children have been isolated for already 3 months and will be for another few months. That is the main driver for why we put this document out, in order to really try to provide a framework of how it could look like for children to go back to school. And
Dr. Cohen, I should mention, so these findings, these recommendations are being considered by the Ministry of Education. Minister Lecce has put something out saying, yes, they appreciate these recommendations. They'll look at all factors and continue to look at all factors through public health moving forward to September. So just because you recommend it doesn't mean all of these things will come into play. But what's interesting, a lot of people are asking the questions about the masks. And through the experts, and obviously you have a number of experts that were consulted on this report, saying that masks should not necessarily be required or recommended specifically for children. And a lot of people are saying why. So I'm going to pose that to you. Why?
I think if you think about specifically younger children and how complicated it might be to put on a mask, to take off the mask, that it's sometimes irritating for children to have the mask in their face. It's actually an increased risk for children putting their finger into their face, trying to remove the mask or readjust the mask. Or if they take off the mask, they may not dispose of the mask in an adequate way. So that's why we are actually recommending to not mandate it for children, in order to not increase actually the risk from contaminating certain surfaces or from contaminating the kids by themselves.
Yeah, I mean, I think it makes sense. I have a 4-year-old, and I know he's constantly touching his face, and there's no way he's going to leave a mask on for that long. Yeah, as adults, right? So I think that makes sense. But there are a number of recommendations. We'll put these back up on you, and ones that aren't. The ones that make sense, right? Being able to distance desks and furniture as much as we can. I have seen online a lot of reaction from teachers who say this is just not feasible, given our class sizes, what we're looking at, being able to do these routine hand washing. These all sound lovely. Unfortunately, to implement them, it's just not going to happen. So will there be any follow-up recommendations from Sick Kids to the Ministry of Education outside of this report?
So I think you need to look at this document as a somewhat living document, which will evolve over the summer as we continue to learn about the virus. I do want to make it clear, though, that we do not profess to be educators or teachers, and we do not want to tell people how to operationalize and implement our suggestion. I think I recognize that it is challenging. What we are really trying to do is come up with a number of guidelines that would allow a healthy and safe way for children to go to school. I recognize that these are difficult at times, and given and pending where the schools are. But I think we need to begin to think about it. That's another reason why we came out with this document so early, that we have time over the summer to think of how some of these things could actually be operationalized and implemented.
Sure, that makes sense. Finally, for you, we are running out of time, but a lot of our viewers, we put this question to our viewers earlier on in the show and got some response here. And a lot of the concern is not necessarily for the kids. As mentioned in the report, it's not about them being the super spreaders that we thought they initially would be. But what about those vulnerable staff You have teachers and TAs and ECEs and whatnot who are all in this environment, and they're exposed too, and then they pass it on. So where's the concern there?
So let me make first clear that here in Ontario, we're still lacking a number of data on children and their risk of transmitting the disease. Although globally, it appears that children transmit the disease not at these high levels that we expected them to do so. If you look at the recommendations, we clearly have recommendations in there to protect teachers as well. And I think it's going to be important to assess on an individual basis if teachers, due to underlying medical conditions, are at higher risk, to put extra measures into place to protect them.
Yeah, well said. Dr. Cohen, we appreciate your time here. And as you said, this is a living document. And if you want to take a look at the document as it exists now, you can go to our website, citynews.ca. Thank you for your time.
Thank you so much for having me.